cancer statistics, what we find is that African Americans have an unusually high rate of metastatic prostate cancer, as well as females having triple-negative breast cancer, as well as ovarian and colorectal cancer. This particular subtype of cancer fits into a category called TRPV6 expressive. This is a wonderful thing for the ancestral populations who live in West Africa, because they're living in very, very low calcium environments. There are no cattle or beasts of burden because of infestations of the tsetse fly. Well, the significance of this is that we therefore have a population that is consuming 200 to 400 milligrams of calcium per day. But what I realized was that this population has very strong bones and is virtually immune to osteoporosis. And so here we have a paradox, or a seeming paradox, where how is this possible to have a particular genetic population that is functioning with very strong bone health on such a small amount of calcium? What happens in the United States, for instance, is that even if you're lactose intolerant, you're eating ice cream, which is low in lactose, and you may be eating various cheeses and yogurt, and you're eating butter and baked goods and so forth and so on. So what it does is it raises your calcium intake, even though you tend to be shying away from drinking milk because milk will make you sick. As various cancers develop, it begins to proliferate in the prostate. It proliferates in breast tissue. It proliferates in the ovaries and so forth. And so the significance here is the fact that there are certain drugs, for instance, that are now in clinical trials that specifically block the TRPV6 calcium ion channel. I think what is most exciting and most important is the fact that when we can identify the particular genetic variant that is being triggered, that is profoundly important, because it means that we can also identify potential therapeutic targets.